Say you are part of our key workers.
Yes, I
That,
am.
that
And
put
my
a
kids
smile
go
on
to
our
school.
face. Oh.
Yeah.
Welcome to Ailey Fashion Lovers Chat Show. In this episode, I will be speaking to Dr. Nora, and she will be telling us how she can use her skills to empower our community. Stay tuned.
Good morning, Dr. Nora.
Good morning.
Can you tell me more about yourself? What do you do for a living?
So first of all, I'm a dentist, and but I have an absolute passion for beauty as well. So I do just general dentistry. I do work for the NHS as well. I've got a contract with NHS, but then I do a lot of beauty stuff. So I've got a master's degree in orthodontics, so I straighten teeth. And then the other thing I absolutely have a passion about is facial aesthetics, because obviously we're dentists, we study the face and the head and the neck when we as well as teeth. So we are the best ones as well to be beautifying the face as well. So I have a passion for facial aesthetics, so youthful looks, everything, trying to surface skin to make it look better and all of that as well.
That's good. That's brilliant. Absolutely brilliant.
Oh, thank you.
What can we do without you? Say you're a dentist, and you did mention you
Yes.
straighten teeth as well.
Yeah.
Yeah. So, can you tell our show how it works? Because this show is more all about empowering people. So we tend to empower people. We talk about things in general, anything we can face in life.
Yeah.
So we talk about it, and we bring professionals like you on board, so you can also contribute by saying the exact thing at the right time in order to create awareness for our community.
Yeah.
Yeah. So when you say you're a dentistry, what exactly does dentistry mean, please?
Right. So dentistry means, first of all, it's treatment of, it's maintenance of health. That's the first thing we do. Most of the people that come to see us only come where they're in health. They just come for a checkup, just to make sure everything is fine. We promote. We just check that they're brushing their teeth really well. We check that they're looking after their teeth. We give diet advice, which is like a big hot topic, because while you guys are staying at home, you need to really be eating the right food and really looking after yourselves while you're at home as well, because otherwise, it's at the moment it's quite difficult to get to a dentist anyway. So it's like changing lifestyles, making sure that the teeth are healthy. Then comes as well the beautifying process. So first of all, we look after the teeth. We make sure they're healthy. Any disease or anything that's there, like cavities or anything, we fix them. Then we replace the missing teeth and look after the gums. And then we start, if someone needs a small redesign or something like that, we want to straighten them, then we can do that as well to make the smiles look great as well.
Oh, and I love your last word over there, saying to make the smile look great.
Yeah. Yeah, I mean, in some countries, smiles, like for example in America, when someone goes for an interview, they need to make sure that their teeth are perfect, because otherwise it does affect them getting their jobs. So yes, that's why you can look in when you watch people on TV, you see that most of them have got really nice straight teeth. That's why. In our countries, it's not a problem, but then as well, would you be more attracted to someone with a really nice smile and good clean teeth, or would you be attracted to someone who's got, let's say, yellow teeth that are missing and stuff like that? It's just natural. It's and then some people, bless them, they always, you can see them when they smile. For example, when they take a photo on Instagram, they smile like this. I know for a fact, if they have all their smiles like this, bless them, they don't have the confidence to show their teeth. And I always say, sort it, because it will make you feel so much better. And when we change someone's smile, and I do it for a lot of my patients, they say, oh my God, thank you for finally getting me to smile properly.
Wow, This is really good. I'll come to why I really like my principle about smiling. I'll come to that again in a minute. So Nora, I understand in your biography on your website, you're not from England.
Yes.
So, I mean, where are you from?
I'm from Iraq.
Iraq, I know that, yeah.
Yeah.
So, can you tell me what brought you to England? Why did you choose to come to England?
Well, I did get married. My husband came to England, and I came as well. Yeah, so it's just like, and my family's here. I have my two kids, and they were born here. I've been here for about 16 years so far, and it is home now. Obviously, like at that time in Iraq, the situation wasn't great, and England was of course a better place, and to be honest, it still is. If we have from PPE. I've got a lot of relatives and family in Iraq, and Iraq is a lot better than what it was before. But I love England. It's my home now, and I can never go anywhere else at the moment.
Oh, bless you, bless you. Tell me, what inspired you to become a dentist?
So when I was little, I always wanted to be a doctor, not a dentist. So when the time came to make a decision, in Iraq there was like a baccalaureate exam, so I got a high degree, so I can choose anything I wanted. But then as I was applying, my uncle, who was a doctor, he told me, "Are you crazy? You're going to be doing late night shifts for the rest of your life. You're going to be studying even more, all of that. Go for dentistry." And my mom's a dentist, but she didn't convince me. But then when I did go for dentistry, oh my God, it was the best decision I've ever made. I absolutely loved it. I love everything about dentistry. I'm one of the most passionate dentists ever. And so it did really, when I got into it, I discovered the love for it and how, I could make a change and how I could be a nice dentist, because so many people are scared of the dentist, let's say, but then I've got whoever sees me, they say, "Oh, I'm scared of the dentist." I say, "You haven't met me yet. You don't know how I do it." And then that making a change of attitude, that really makes me passionate.
I love that change of attitude. That's really good. So prospect is a plus for you to have a very nice set of teeth.
Yeah,
because we believe when you meet people, when you smile at people, it opens doors for people, and it helps to boost your confidence and other people's confidence, knowledge,
exactly.
their presence in that place.
Yeah, on a social level and on a professional level, both. It's just it shouldn't be underestimated. That's why I try to always motivate people to sort it out. You'll be so much better on every single way.
That's good. Well done. Thank you very much for that. And during your dentistry profession, have you ever come across anything that makes you probably that is a bit stressful regarding your job?
Yes, the stress that we have sometimes is you don't get on with everyone. Not everyone. You will always find in life that not everyone is going to get on with you.
Yeah.
So the stress it comes from people trying to let's say they want to address their problems. So trying to address their problems and help them. That's where the dealing with that will can go on, how we can deal with it. So yes, it's no matter how good I am, I have very, very, very minimal complaints from patients, but you can't get on with everyone. Sometimes things happen. They have a filling done and then they go back home and the tooth breaks. Or there are people that, for example, we do something like a crown or something, we fit it. It's not the perfect match how we want it to be. The thing is, how do we deal with it? Yes, I have to deal with perfection. I can't take it on me that something is not perfect. We address it, we send it back, we correct it, we give it back, and that's how to deal with it. The main thing is, if something goes wrong, just keep calm down the patient, and then deal with it. It's a lot better than getting stressed and flustered and you don't know how to deal with it. And then, so that's what because I train dentists as well when they first graduate. I used to, at the moment I stopped it. But then I used to tell them, learn how to do it perfect and then pick up with speed. If you don't know what to do, go and ask.
That's a very good one.
It's a lot better than just dealing with it yourself.
Good. So, I looked at your website. It says you also facial. You do something relating to face.
Facial aesthetic. We call it facial aesthetic. You know, improving the face, like the face and everything like that. Yeah.
So, tell me more about faces. What's so special about faces?
So with facial aesthetics, it's about as well, like, you know how we talk about teeth with like improving the smile and making the teeth look absolutely perfect and all of that to help you smile. It's not, facial aesthetics started like a long time ago about like how to make you look youthful and how to address, let's say, wrinkles and lines and stuff like that. But now it's going more into the millennial generation as well, because it's not just about making you look youthful and improving lines. So it's about symmetry. So sometimes, like, people have like one eyebrow higher than the other, we can adjust that. We can make it symmetric. Some people would like to have lifting of the eyebrows, we can do that, make it like look a little bit better. People like to have fuller lips, for example, we can do that. We can, but my ethos is like, for me, it's different because I like to make it look improved, but not look like you're done. Like, make it look improved, but look natural. I don't like people to look like they're botched up or they're done. So many of my patients, whenever they walk around, they say, "Oh my God, you look amazing," but I don't know what it is. It's because they had it done very subtly, so that it will look like an improvement, but then not look done. For example, for the tear trough fillers, like so many younger ladies, they've got sunkenness under the eyes. That's not related to age. It could be related to age. They could have dark circles or stuff like that, because of tiredness and stuff. But when there's sunkenness there, no matter what you do, you have to put concealer and everything. But then when you have the tear trough filler, it brings it up. It makes it look really nice. And that's why, you know, it does make a difference. There are thread lifts that pull the face, stuff like that, all sorts, you can imagine. So what we do is usually someone will come to me for a consultation. What is it that you're looking for? What is it? And then some people say, okay, you tell me what you want, what I need. And okay, here we go. We start with something. Or if it's something that they're saying, oh, I just want this done, I just want lips done, I just want whatever, then we can address that. So it depends on what they want.
Wow, that's really good. That's really good. So I really, you know, when I was growing up, I always admire anything that has to do with beauty, that has to do with faces, that has to do with the way you smile.
Yeah.
I always say smiling is part of my magical weapon.
Definitely. If you smile, it will make you feel happy.
Exactly. When we talk about the smiling part, I just always cherish it, because smiling, I believe it opens doors. It can open, you know, locked doors, and, you know, doors that you don't ever believe can be opened.
Yeah, definitely. I totally agree with that.
Like me, I love networking a lot. I call myself a networking animal. Like I network like a machine, you know. I meet great people, you know, and I'm quite grateful for that. And this is also, it's got to do with the power of my smiling, power of my, you know, my facial structure, which you also, you know, specialize on, and you're also confirming why we have to kind of like look after it.
Yeah, definitely. And sometimes, like, there's things like, if there's something is not symmetric, usually sometimes, you know, people don't notice it, but if something is not symmetric, even whatever they're talking about, people get distracted by that, you know, they will keep looking at it and thinking, okay. So it's just like, I don't know, it's kind of interesting, isn't it?
It is. Oh my God. Oh dear. So, you know, looking at this issue here, your beautiful work here, your profession, which I really, really love, society that we are now in the world, I should say, at the moment. I mean, I'm sure you've heard about the virus issue, which is the coronavirus. How has that impacted your work currently?
So it started when the coronavirus came out. We were very, very worried because we were still treating patients. Up until last Wednesday, I was still treating patients.
Okay.
We were still doing, you know, so the week before that, 2 weeks ago, they told us not to stop treating normal patients, let's say, like just routine treatments, and to start focusing on doing only, like, we can only treat emergencies, right? So just 3 days last week, we were treating only emergencies. Then, and still with that, what the guidance was for dentists in the UK was like, we treat them with the normal face mask that we have. And there was a big uproar from dentists thinking, okay, we're the closest to the people. How can we just wear the normal mask that we're wearing and not risk like us getting infected? But more importantly, if we get infected, imagine how many people I'm seeing during that day, and I can pass it on to them. So finally the decision came up where and I was really talking about it on video. Look guys, only if you have an emergency, come and see us. But then finally the decision came up on last Wednesday, to stop treating patients at all completely, and we can only speak on the phone. Right. So at the moment, what we do is, between me and my colleagues, we always, one of us is there in the practice, and we speak on the phone to urgent cases. We can prescribe antibiotics without seeing them, which is very weird, because we always need to see them to give them the antibiotics for, let's say. But then they're going to open, hopefully next week, specialist centers where proper protection is worn, and then only the emergency cases are being seen. So I can't do any of my beauty treatment, I can't do any of my smile makeovers, I can't do fillings, nothing at all. But then we all signed up as well, like they sent us an optional letter to ask us if we wanted to be redeployed into the hospitals.
Oh.
So we don't know how it's going to be, how the situation is going to be, but of course, if our colleagues are going to be struggling, then we would be happy to help.
Okay. So currently, do you work directly with the NHS, or you work as a private dentist?
I've got both. I've got mixed. So I work NHS. I've got NHS contract, and then I do half NHS and half, you know, cosmetic and private.
I would say you are part of our key workers.
Yes, I am.
That put a smile on our face. Oh,
yeah.
Bless you. So, how do you feel? Do you feel protected at the moment? Say, for instance, if you go back to work now, do you feel protected at all?
No, that's a worry that we all have, is because we don't know what we're going to do if we are going to go to work. We don't know what they're going to provide us and what our role is going to be. I might be a nurse in the intensive care, you know, I don't know. I'm just happy to help if I'm needed. If we're going to work in one of those dentist specialist centers, then yes, they are providing finally the proper protection. But in hospitals, it depends on what we're going to get, like, because my husband does work in the hospital, he's a doctor. So so yes, he doesn't really have that protection he needs, and that's why we've been very vocal about it as well.
Do you know, talking about the protection part, I used to work in the healthcare sector as well, but yeah. I can see a couple of things that I don't feel too comfortable about. So when this topic comes out about you know, no, they haven't got enough protection, I can see a good sense in it. So
Yeah.
usually they do advise probably the healthcare practitioners to have like what's it called, like a booster injection in order to protect yourself just in case of anything coming up,
Yeah.
stuff like that. Either, to stop the transmission to you and to other patients as well.
Yes.
Yeah. Mm-hmm. So, well, I hopefully let's keep fingers crossed to make sure this is well sorted and the pandemic is reduced and it doesn't escalate more than this.
Yeah, we just hope that everyone comes out of it the other end being
Okay.
healthy, minimum losses. We can't really say that no losses or whatever, minimum as much as possible.
I know. It's quite heartbreaking that this has to happen like this. However, I'm quite certain that the government must be running around to make sure they put things right at this present time and for future wise as well.
Definitely.
So tell me, how do you reassure your clients if something happens, or say for instance you have a patient that comes into your practice to talk about things? How do you get to kind of reassure them? Because I know this dentistry thing will have like can easily have a psychological effect on them, physical effect, and mental effect as well. How do you reassure them if you can sense this kind of thing is happening or wants to happen to a client?
You mean in normal times or now?
Oh, no. In normal times, one, and this kind of, this current time as well.
So if someone is really stressed about, like, for example, in normal times when a patient comes, for example, with pain, they come and sit and they're crying with pain. I say, okay, hold on a second, check their medical history, they're okay. Immediately I try to numb them up just so that I can take the pain off them, and then they can speak properly. They can speak better, they can calm down and speak and stuff like that. And then what we can do is, like, I can take whatever the history is. If they're okay, they can get by, then we take the history, we see what they have, like what they've been taking, painkillers. Usually they dose up on painkillers, so it's not that bad when they come to us. But then afterwards, then we can address it. If it's pain, then I will either we'll numb up the tooth, obviously, and then I could take out the nerve. I could give them some antibiotics if they need it. If they've got a cavity, then at least I could do a filling, but sometimes I will just put a temporary just until we can see them again. So there's always something that we can do as an emergency. Now, while we're at home, I can only speak on the phone. So I did videos as well about how to deal with emergencies. So I refer them to my Instagram. And this is how you put a temporary filling. This is how you do this. This is how you treat this. So I'm trying to help as much as possible to get people to get by.
Yeah. So now I understand that you've stopped treating patients, and you only do like a one-to-one conversation via the video chat and stuff like that. Yeah?
No, not even on video. It's only on the phone.
Oh, just on the phone. Oh my goodness.
Yeah.
That is so hard.
It is, It's kind of difficult, yes.
Very, very difficult. So you help to kind of like talk to them, and you check their medical history to make sure they are fine and stuff, everything like that, before you can know how to proceed with things. Yeah?
Yes.
So for instance, if you have somebody calling you now that has got the coronavirus issue, or that is thinking, oh yeah, I think I've got the coronavirus, how do you deal with this? And how would you know if you've got it?
We do monitor people, like we do ask them. That's as soon as the coronavirus came out, we had the guidelines about asking people, even when we were seeing patients for emergencies and stuff, do you have a temperature? Do you have a cough?
Okay.
That's the main things that we ask for. Do you have a temperature? Do you have a cough? Do you have a headache? Something like that. If they do say that they've got one of these issues, then we are not allowed to see them, full stop. Not allowed. even when we were seeing patients. At the moment, if they've got the coronavirus, what they're saying to people is that if you're fit and healthy, you can still breathe, you can still talk, you can, you know, although you're coughing, treat it like the flu, stay at home. Don't do anything. If they've got like a dental issue, then sort it at home, do whatever you can do not to leave the house, take only paracetamol, not ibuprofen. If it does get to a point where you really can't breathe and you're really struggling, that's when you call the ambulance, or you can go to hospital, because people are wasting their time going to hospital if they don't have severe symptoms, because they won't be admitted. Stay at home, work it out. Most of the people will recover. They will be fine.
Okay. Oh. So, like this morning, I had somebody contacting me on Instagram telling me he's also got the coronavirus. So I try to, you know, just try to reassure them to, you know, make sure, you know, they speak to the right person at the right time. But I could see they have a bit of panicness in them. Why?
Yeah.
Because they've got a friend's dad that passed away recently relating to the virus issue. So I was trying to reassure them just to calm down and see if they've been tested. So this person told me, "Oh, I'm sorry, they don't test. They don't give tests to people now." So do you think the test will be coming up soon, or what? Will they just leave people like that?
We are hoping so. At the moment, the testing is going for only the people who are really severe, that they get admitted into the hospital, so they test them. Not even NHS staff are being tested yet as on a high scale. I think they started testing just a few, but that's the main thing, is that, like, first of all, they will test the ones who are admitted into hospital to make sure that it is coronavirus, and they put them in the proper wards. Then what is going to scale out on into testing NHS staff who are looking after them, because if one of the NHS, if, like, for example, if I'm a nurse and then I've got coronavirus and I'm walking around, I'll be infecting everyone around me. So they need to really be testing the staff. And then the other reason for testing the staff is that if someone has a cough, just a normal cough, they, at the moment, the guidelines say you have to stay at home for 2 weeks. Now that will make your colleagues work on double shifts. That's what my husband is dealing with. People are going off for 2 weeks just because they have a cough or temperature. And then everyone has to be dealing with double of what they had already. Well, if it's not coronavirus and they get tested, that is fine, then they can still continue to work. So that's the main issue that they want to do with staff. Afterwards, then they can test onto like normal people or something, if we have like tests available for that.
That's good. Wow. Well, so hopefully they need to just stay in the house for 2 weeks. Yeah. And I mean, within that 2 weeks,
if they are testing positive, they are positive, then they have to get better and then come back. If they get tested when they have a cough, for example, and they're okay, they can continue working. Well, like what the guidance is now, if they're not tested, they have to be off for 2 weeks. It saves everyone, like one of the colleagues being off for 2 weeks with no reason.
Wow. So after that 2 weeks, does it mean they will have passed the peak period, is it called?
Yeah, so within the 2 weeks, usually the incubation period is about 2 weeks. So within 2 weeks, if they're infected, it will show. It will get worse. It will whatever, you know, it will be that way. If in 2 weeks it shows. If nothing happens in 2 weeks, then they're fine. They can go back to work.
Oh, I see. So after that 2 weeks.
But then the problem is happening is that if someone has a cough within their family, so it happened to one of my friends. The daughter had a cough. She was off for 7 days. Everyone else in the family has to be off their work for 2 weeks. The mom is an intensive care nurse. She was off for 2 weeks. She didn't even have a cough. Her daughter had a tiny cough, but everyone in the family had to be off for 2 weeks. Imagine the strain that will apply on everyone.
Everybody. So, I mean, if everybody stays in the house at this this 2 weeks time, will they be paid, you know, their salary? Because, you know, this is also affecting people
Well,
financially?
yeah, that depends on what they're doing.
Contract.
It depends on their job. It depends on what, all of those things that the government is providing. It depends on what bracket they fall in under, So whether they get paid for sick pay, I don't know. Like, it depends on what jobs they've got. If they're self-employed, they got nothing,
I know, that's the thing. Well, so the guideline and the advice you can give to people that will obviously watch this relating to coronavirus will be they stay indoor for 2 weeks, or if nothing is happening, or just listen to the government or check the government website, or what would you say?
If someone suspects they've got coronavirus, just stay at home.
Okay.
Stay at home. Self-isolate, don't mix with anyone, have some warm drinks and hot drinks. That helps a lot. It's really eases up the chest. Don't go out. Only if you feel like you can't breathe, physically can't breathe, then go and call 111. That's it.
Okay.
Everyone else in the family, like, beware. That is they have to be off for 2 weeks as well. Unless if something else happens, like more testing happens or whatever. But then that's the thing. If someone suspects coronavirus, that's it. You just stay at home and just look after yourself until you get better. So that's what it is. The best vaccine for coronavirus, stay at home.
Stay home. So what if people decide to break the rules? Because you never know. Some people might be like, oh, I'm not bothered. What do you think about that? What's the consequence of that?
Honestly, like, people think like, oh yeah, I'm allowed to shop, then I'll just go and shop every day. For God's sake, just stay at home. Shop enough what you want. Delivery is available now to everyone. Get it delivered. What we're doing we've got this really amazing thing, like in our neighborhood, like our roads, we all have a WhatsApp group. If anyone wants to go shopping, we ask everyone else in the road, do you need anything from the shops? And they go and get it. Sometimes there's you just need like a couple of tomatoes or just onions or whatever. There's no need to go for the shops for it. Ask people like around you. That's something that we're doing as well. Like, we got WhatsApp group. First of all, it started, we identified which are the houses that got elderly people. And then we tell them, if you need anything, you don't go out, we're going to get it for you. And then between us, like even the normal families, whenever we go, oh, do you need anything from the shops? We're going. Okay, yes, can you get me this? Can you get me this? And it's great, Try to minimize how much you go to the shops. And then, like, when they were saying, you're allowed 1 hour of exercise, you can go out. Well, there are online classes. I just do it. I've got like this Beachbody subscription. I do it like in the lounge. Why would I want to go out? Yes, it's nice to go out for the sun or whatever, but minimize it.
Okay,
that's what we're saying. Minimize it. Even if you're allowed it every day, don't do it. Try to minimize it, because you're saving yourself and you're saving other people.
Okay, so if they minimize it, it means they will be saving other people and also saving, themselves as well.
Of course, yeah.
Okay. All right. Okay, that's good. So, can you tell me, what would you advise? Well, what would you tell your younger self? What your younger version? What would you say to your younger version?
Yeah, I will always say, follow your dreams. Look at what makes you passionate and then go for it. And it's exactly what I did. I always find out what really gives me the butterflies in my belly, and I go for it, because that's what really will keep you motivated and really make you go forward and look forward to other things.
Okay, so what if people tell you actually you can't achieve that dream? What would you say, and how can we break that negative thoughts or negative words?
I will always look into why did others achieve it? What did they do to achieve that dream? So for example, like when I first graduated, so when I came here to England, it's kind of difficult to assess that the universities in Iraq are like what they are and how they work. So applying for my first job was the worst thing, was really difficult. So when I was applying for jobs, I was looking into it and thinking, okay, I've got a dental degree. Someone else has got a dental degree. Someone has got 20 years more experience than me. How am I going to make my CV look better than them, so that when I apply for a job and someone who's got 20 years experience, what will make them choose me? So always think of what will make you raise above the others, because in some jobs, when you apply for it, there are the essentials, and then there's desirable. Everyone who applies for the jobs has done the essentials. You need to tick the desirable so that you can get into that job and do what you want to do. Wow. So I would say, look at what other people have done, how they achieved it. I would say call and look and ask, how can you get there? Because that's the way that will make you get there. You've got nothing, they got nothing on you.
Great. So if someone wants to be a dentist now, what's the process? What's the procedure? How many years do you have to study for? Is there a short way to, maybe short courses to do in order to get to the side of it? No? Okay. So what's the process in a quick way?
It depends on the country. I mean, in the UK, they need to take the desirable, the essential, let's say, and then do the A-levels and get good grades to get accepted. Okay. In other countries, they need to do the baccalaureate and get high degrees and then get accepted. But it is 5 years in most countries. Yes, it's 5 years. In America, I think they've got 4 years of biology, and then they do 4 years of dentistry afterward. So it depends on what country you are in, but then it's always 5 years. But then afterwards, there's another year of experience, and then whatever you choose to specialize in, because there are different specialties in everything. So whatever you find passionate about, then you can go for that.
That's really good. Well, it's lovely to talk to you, Nora. Thank you so much.
Thank you very much.
Can you tell me? I'm quite pleased how you've shared your knowledge with us here. But can you tell our audience where people can easily find you? Your website? Where are you situated? What's your Instagram details? Can you tell the viewers here, please?
Yes, most of my the posts that I do put are on Instagram. I do put a lot of videos and updating and stuff like that that's going on, and I do like to share as well photos of before and after, which is very fascinating. So my Instagram is dr.nora.albaldawi. It's kind of like www.smilesbynora.co.uk. So smiles, it includes the smiles, includes the teeth, it includes the face. So that's why I chose that word, because it makes everyone happy.
Oh, that's good. So you always use your skills to empower the society by obviously adding a plus to their smile and their faces as well, how to look after their face, their dental, how to smile in general. That's how you empower people with your skills.
Exactly. When you smile, people will like you. It's just like, it's just magic, isn't it?
Yeah, it is magic, I'll say.
Yeah.
Well, Nora, thank you very much. You have been...
Thank you very much. I really enjoyed it.
Oh, thank you. You've been an angel to me. Thank you so much. Because it's not easy to come by a pleasant person like you, sharing your skills with our audience, encouraging everybody or anybody from anywhere in the world with your skills. Thank you so much, and I really appreciate this.
Thank you very much. I do as well. And if anyone has got any questions, then I'm absolutely happy to answer them as well.
Thank you very much, Nora. Do you have a
thank you.
good time, and hope you stay in as well.
Yeah. Well, not me. I'm a key worker, unfortunately. I hope everyone else stays in so that we can protect you.
Oh yes, obviously, yes. Thank you so much for your time, Nora.
Thank you.
Thank you.
Thank you very much.
Thank you.
Bye.
Bye.